Before you can help an ill or injured person, you must make sure that the scene is safe for you and any bystanders. Check for anything unsafe, such as spilled chemicals, traffic, fire, escaping steam, downed electrical lines, smoke, or extreme weather. Avoid going into confined areas with no ventilation or fresh air, places where there might be poisonous gas, collapsed structures, or places where natural gas, propane, or other substances could explode. Such areas should only be entered by responders who have special training and equipment, such as respirators and self-contained breathing apparatuses. If these or other dangers threaten, do not go near the ill or injured person. Stay at a safe distance and call 911.
Does this scene look safe to you? How about this one?
The second thing you must do is figure out what happened. Look for clues to what caused the emergency and how the person might be injured. Nearby objects such as fallen ladders, broken glass, or a spilled bottle of medicine may give you information. Your check of the scene may be the only way to tell what happened.
What do you think happened in this situation?
The third thing you must do is see how many people are involved. Look carefully for more than one person. You might not spot everyone at first. If one person is bleeding or screaming, you might not notice an unconscious person. It is also easy to overlook an infant or a small child. In an emergency with more than one victim, you may need to prioritize. In this case, it means decide who needs help the most.
Where could someone be trapped in this picture?
The fourth thing you must do is determine if there is immediate danger involved. Do not move a seriously injured person unless there is immediate danger, such as fire, flood, or poisonous gas. You have to reach another person who may have a more serious injury or illness, or you need to move the injured person to give proper care. If you must move a person, do it as quickly and carefully as possible. If there is no danger, tell the person not to move, and tell any bystanders not to move the person.
Is there immediate danger involved?
Now you must find out if the victims are already receiving help. As you might know, the presence of bystanders doesn't mean the victim is already being helped. You may have to ask them to help. Bystanders may be able to tell you what happened or direct you to someone or the nearest telephone. If a family member, friend, or coworker is present, he or she may know the person is ill or has a medical condition. The ill or injured person may be too upset to answer your questions. A child may be especially frightened. Anyone who awakens after having been unconscious for a few minutes may also be frightened. Bystanders can also help comfort the person and others at the scene. Parents or guardians who are present may be able to calm a frightened child. They can also tell you if the child has a medical condition.
Do you see any bystanders that could help in this situation?
Finally, it's your responsibility to find out what's wrong. When you reach the person, you must try and see what the problem is. Look for signals that may indicate a life-threatening emergency. First, check to see if the ill or injured person is conscious. Sometimes this is obvious. The person may be able to speak to you. He or she may be moaning, crying, or making some other noise, or moving around. If the person is conscious, reassure him or her and find out what happened. If the person is lying on the ground silent and not moving, he or she may be unconscious. Unconsciousness is a life-threatening emergency. If the person does not respond to you in any way, assume he or she is unconscious. Make sure that someone calls 911 and locate the emergency number right away. Look for other signals of life-threatening injuries or injuries that may become life-threatening. These include no breathing or trouble breathing, no signs of life, or severe bleeding. While you are checking the person, use your sense of sight, smell, and hearing. They will help you notice anything abnormal. For example, you may notice an unusual smell that could be caused by poison. You may see a bruise or a twisted arm or leg. You may hear the person say something that explains how he or she was injured.
Does this person look conscious to you?
Keep in mind that it is often helpful to take a slightly different approach when you check and care for infants, children, and elderly people in an emergency situation.
What modifications were made for this child?